created using Powtoon.
Hi, I'm Ashley Shancool, registered dietitian and certified diabetes educator at Mid-Michigan Health. I'm here today to provide you with more knowledge on prediabetes and reducing your risk for developing diabetes. Prediabetes affects 35% of adults age 20 and older and half of Americans age 65 and older. Without weight loss and physical activity, 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years. So the goal, identify prediabetes and take action to reduce the risk of developing diabetes. Prediabetes can be a silent disease. It usually happens without symptoms, but we know elevated blood sugars affects the eyes, nerve endings, the heart and kidneys, leading to serious health complications. A prediabetes diagnosis increases your risk of heart disease and stroke by 50%. How is prediabetes diagnosed? If you had a fasting blood sugar of 126 or higher, that is diabetes. Prediabetes is 100 to 125, and non-diabetes is less than 100. If you had a non-fasting blood sugar test and your level was 200 or higher, that is diabetes. 140 to 199 is prediabetes, and a blood sugar of less than 140 is non-diabetes. Risk factors for developing type 2 diabetes include having a family history of diabetes, if you are overweight with a BMI of greater than 25, over age 45, if you've had a diabetes during a pregnancy, have given birth to a baby weighing over 9 pounds, have had the stress of an illness or injury, have high blood pressure, or belong to certain ethnic groups such as African American, Hispanic American, or Native American. How do I reduce my risk for type 2 diabetes? Step 1, decrease your current weight by 5 to 10%, eat a variety of healthy foods, reduce total daily calories by monitoring carbohydrate and fat intake. Step 2, try to accumulate 30 minutes of activity most days of the week. Start by making healthier food choices, balancing calories, and increasing your intake of fruits and vegetables and whole grains. And try to reduce your intake of sodium, especially in foods like canned soup, canned vegetables, and frozen meals. Drink water instead of sugary beverages. You can also reduce your risk by watching your salt and sodium intake. Try to keep your salt to about 1,500 milligrams per day. And did you know that a teaspoon of salt has 2,300 milligrams of sodium? Increasing your fiber can also reduce your risk. Eat plenty of fruits and vegetables. Eat whole grains, especially with foods that have whole grain listed as the first ingredient. Eat brown rice and whole wheat pasta instead of white. And choose higher fiber snacks such as popcorn, vegetables, and high fiber crackers. Try to eat more fresh and less processed foods, and it is better to get fiber from food rather than supplements. Try to know how much you're eating by watching your portions and using easy tools like the size of your hand to estimate what a half cup versus 1 cup is. You can also use the plate method to help you control your portion sizes. Think of your plate into 3 sections. Fill half your plate with vegetables and the other half with whole grains and lean protein. How can you increase your physical activity each day to reduce your risk? Studies show trying to include 30 minutes of physical activity most days of the week can be helpful. It can be 1 30-minute session or 3 10-minute sessions. Physical activity is any movement of your body that uses energy. Daily ideas for 30 minutes of physical activity include dancing, household chores, yard work, gardening, walk breaks, park your car further, walk your dog, taking the stairs, or even wearing a pedometer to make you aware of how many steps you're taking each day. Key takeaways for reducing your risk of diabetes. Losing as little as 5 to 10% of your current body weight will improve blood sugars and reduce insulin resistance. Engaging in regular physical activity at least 30 minutes most days of the week. And take action by avoiding sugary beverages and reducing portions. I hope that this information on prediabetes was helpful. At Mid-Michigan Health, we celebrate the power of health throughout life with you.
In just 1 decade, the number of people with diabetes has more than doubled.
According to the Centers for Disease Control and Prevention, by 2050, 1 out of every 3 of us may have diabetes. What's the big deal? Well, the consequences of diabetes are legion. The #1 cause of adult onset blindness, the #1 cause of kidney failure, the #1 cause of surgical amputations. What can we do to prevent it? Well, the onset of type 2 diabetes is gradual, with most individuals progressing through a state of prediabetes, a condition now striking approximately 1 in 3 Americans. But only about 1 in 10 even knows it. Since current methods of treating diabetes remain inadequate, prevention is preferable, but what works better, lifestyle changes or drugs? We didn't know until this landmark study was published in the New England Journal of Medicine. Thousands were randomized to get a good double dose of the leading anti-diabetes drug, or diet and exercise. The drug, metformin, is probably the safest diabetes drug there is, does cause diarrhea, and about half of those who take it, makes 1 in 4 nauseous, about 1 in 10 suffer from asthenia, from the Greek meaning lack of strength, causing physical weakness and fatigue. But the risk of being killed by the drug is only about 1 in 66,000 every year. And the drug worked. Compared to placebo, in terms of the percentage of people developing diabetes within the 4-year study period, fewer people in the drug group developed diabetes. But diet and exercise alone worked better. The lifestyle intervention reduced diabetes incidence by 58%, compared to only 31% with the drug. The lifestyle intervention was significantly more effective than the drug and had fewer side effects. More than 3/4 of those on the drug reported gastrointestinal symptoms, though there was more muscle soreness reported in the lifestyle group on account they were actually exercising. Other studies subsequently found the same result. Non-drug approaches, superior to drug-based approaches for diabetes prevention. And the 50% or so drop in risk was not for people that actually improved their diet and lifestyle, but just those instructed to improve their diet and lifestyle, whether or not they actually did it. Check this out. This is one of the most famous diabetes prevention studies. 500 people with prediabetes randomized into a lifestyle intervention or control group. And during the trial, the risk of diabetes was reduced by that same 50 to 60%. But only a fraction of the patients met the modest goals. Even in the lifestyle intervention group, only about a quarter were able to eat enough fiber, meaning whole plant foods, and cut down on enough saturated fat, which in this country is mostly dairy, dessert, chicken, and pork. But they did better than the control group, and fewer of them developed diabetes because of it. But what if you looked just at the folks that actually made the lifestyle changes, met at least 4 out of 5 of those wimpy goals? They had 0 diabetes. None of them got diabetes, 100% drop in risk. Bottom line, type 2 diabetes can be prevented by changes in lifestyle, even in high-risk prediabetic subjects. The fact, then, that type 2 diabetes, a largely preventable disorder, has reached such epidemic proportion is a public health humiliation.